Good morning. My name is Ed Flynn, District 2 City Councilor. I am the chair of the City Council Committee on Veterans, Military Families, Military Affairs. Today is July 25th, 2024. This hearing is being recorded. It is also being live streamed at boston.gov/citycouncil-tv and broadcast on Xfinity Channel 8, RCN Channel 82, FiOS Channel 964. Written comments may be sent to the committee email at ccc.vma@boston.gov, ccc.vma@boston.gov, and will be made part of the official record and available to all councilors. Public testimony will be taken at the end of this hearing. Individuals will be called on in order in which they sign up and will have 2 minutes to testify. Obviously, people can testify in person in this City Council chamber. They can testify over Zoom. They can send an email to me and to the committee as well, and I'll make sure it is part of the official record. If you are testifying in person, please add your name to the sign-up sheet near the entrance of the chamber. If you are looking to testify virtually, let our Central Staff Liaison, Shane Pack, know. Shane, S-H-A-N-E, at shane.pack@boston.gov for the link, and your name will be added to the list. Today's hearing, docket 0349. It's an order for a hearing to discuss the goals and priorities of the City of Boston Office of Veterans Services. In docket 0588, which is an order for a hearing to discuss services for women veterans. On the second docket, as it relates to women veterans, it's also important that we hear testimony and comments from the public. As we know, women veterans are the fastest growing population of veterans utilizing VA services, but also want to ensure that our city leaders, our state leaders, and federal leaders provide comments on what's important to them, what's important that they are working on, and how they are working on issues impacting veterans and military families. I do have a letter of absence from City Council President Rutzi Louis-Jean. I'm not going to provide my opening comments at this time. I might do that towards the end. But we do have an expert panel that is with us today, and I'm honored to have them, including the Commissioner of City of Boston Veterans Services, Rob Santiago, United States Navy retired, doing an exceptional job supporting veterans and military families across the city, and their staff as well. I also want to acknowledge the City of Boston Veterans Service staff that's also here and the work they do as well. Director Vincent Eng, who's the director of the VA Boston Healthcare System. Had an opportunity to work with the director for many years and impressed at the services and support they provide to veterans across New England, including right here in Jamaica Plain and West Roxbury as well. So Director Ring, it's an honor to have you on as well. Director Ring is going to be testifying virtually. We also have with us Coleman Nee, who's a national officer with the Disabled American Veterans, also served as the Secretary Commissioner for the State Department of Veterans Services as well, leading advocate across Massachusetts and the country in support of veterans and military families. Coleman, it's good to have you here with us. My good friend Haywood Fennell, a leading veteran and works in the many communities of color across the city, might be joining us, along with Mary Tewitt, who's the commander of the William E. Carter Post in Mattapan. At this time, I am going to ask Commissioner Rob Santiago to offer opening testimony on the priorities, his goals, and what we can look forward to in terms of their outreach and services that the City of Boston Veterans Services are currently doing, what his top priorities are, and what we need to do to continue to work together to ensure our veterans and military families get the services and programs they need. After that, I'm going to go directly to Director Eng from the VA and basically ask him to provide an opening comment, opening statement on what the VA priorities are right now, and especially on women veterans, on LGBTQ veterans, but also ensuring all veterans have equal access to services and programs. And I also, after Director Eng, do want to ask National Officer Coleman Nee as well to highlight some of the priorities that the disabled American veterans are focused on, including mental health counseling and the growing suicide we are seeing among veterans across the country. I do know that Coleman has been on the forefront of ensuring veterans are heard on Capitol Hill and enacting policy legislation, working with our congressional leaders to implement change. So I want to say thank you to Coleman. I want to say thank you to Rob and to Director Eng as well. Let me start with you, Commissioner Santiago. It's good to be with you.
Thank you, Council Flynn. It's good to be with you as well, and thank you for having this hearing and allowing me the opportunity to speak on behalf of the City of Boston Veterans Services. I first also want to echo comments about Mr. Coleman Nee, Secretary Nee, and all the great work he does. I could tell you he's definitely been one person who I've leaned to quite a bit during my tenure as commissioner and also as deputy commissioner and as a fellow veteran. So Coleman, thank you very much for all you do for our community. For Director Eng, who is also on the line, and all the great work him and his staff does at the Boston VA healthcare system. So I want to start out with talking about our military veterans and who have always answered the call in times of crisis and uncertainty here in our country. When there was a need, they answered the call. Now it is definitely incumbent upon us to return the call in their time of need. The mission of the Mayor's Office of Veteran Services is to facilitate full and equal participation in all aspects of life for veterans and their families who call Boston home. OVS recognizes, engages with military service members, veterans, their families, and survivors by connecting them with the benefits, services, and resources that they've earned. So we strive to continuously find innovative ways to support veteran service members and their families to live healthy and thriving lives. It's important for this office to be a one-stop shop and bridging those gaps for all our veterans and their family who call Boston homes. Our main mandate is to assist Boston low-income veterans and their families, as well as veterans experiencing homelessness. Massachusetts General Law, Chapter 115, is a source of income for at-risk veterans. These benefits also include military burial assistance, subsidies for medical expenses, and decorations of veterans' graves and hero squares for Memorial Day. So far this year, we have had some very successful events for our military and veterans community, to include the Women's Roundtable, Black Veterans Appreciation Brunch, and our Welcome Home breakfast. These events include members of our veterans and active duty communities and their families. These events continue to allow us to promote all our programs, services, benefits, and it also allows our community partners like the VA and the DAV to do the same. These events is also an opportunity for me to meet with veterans and hear their concerns and how I best and our office could best assist them. We understand that all our veterans and families cross all demographics, so it's important for us to include other city departments. At these events, we have coordinated and worked with Women's Advancement, Age Strong Commission, the BCYF, Black Male Advancement, and the Office of Neighborhood Services, to name just a few. This also enables our external partners an opportunity to expand their reach to the veterans and military communities. Some of these organizations include the DAV, the New England Center and Home for Veterans, VA Boston Healthcare System, Frost Call, Community Rowing, the Boston Vet Center, and Bright Marine, also just to name a few. A great upcoming event for our veterans to access essential supportive services to include employment assistance, housing assistance, medical care, and more is the Greater Boston Stand Down, which is held every year here at City Hall Plaza. This great event is in partnership with the New England Center and Home for Veterans, the VA, the Department of Labor, and of course the City of Boston. It's going to be held on Friday, September 20th from 8 a.m. to 2 p.m. I urge all veterans to come out and meet with their service providers, employers, and community organizations. If you want to find out more about this or any upcoming events, on our website we do have an extensive list. You could go to www.veterans.gov/veterans for the most up-to-date information on our community partners and all the events that we have coming up. So as I said, we maintain a great partnership with other veteran organizations throughout the Commonwealth. Many of our veterans are transient and jump from city to city. We maintain close communications to ensure that the veteran is taken care of no matter what town or city they relocate. We are also part of a large network of veteran services officers in the Commonwealth who share best practices to ensure continuity of services to our veterans and their families. And as successful as our programs and outreach has been, there is always going to be room to expand. There are many different ways I plan on expanding our outreach and promoting the Mayor's Office of Veteran Services. I believe one of the most effective ways is to go into the communities and meet with our neighbors and educate them on our services and resources in partnership with ONS, with other city departments, and all our community collaborators. I have also worked with the Adjutant General, General Keith, and his staff to give our Veterans Benefits Specialists at OVS access to vital records of our veterans to ensure timely process of benefits and services. I am also currently working with Secretary Santiago in accrediting our VBS with the National Veterans Legal Services Program. Another thing that I plan to do is to continue to attend post meetings and also community meetings. I will also be reaching out to younger veterans in colleges and universities and continue going to senior centers in partnership also with Age Strong. We have had a very successful mini grant program last year that we are also looking to expand. This is the Bridge to Gap mini grant program, which allowed us the ability to give veterans access to new and expanded community building programs through our partners. That includes Blue Star Families and the unique mental health program and stress relief outlets with PGA Hope, Community Rowing, and Frost Call, to name a few. It has allowed us to reach veterans and also give them increased access to transportation, as well as food and health wellness services through the Heroes Haven project of the South Boston Neighborhood Development Corporation, and increased access to neighborhood-specific health and mental health clinics and programs at Bright Marine and the Disabled American Veterans, DAV, with Harvard Street Health and Benefits Outreach Center, which services Dorchester, Mattapan, and Roxbury for approximately 250 to 300 veterans and their families. The DAV also plans to help these veterans file and process disability claims and access other federal resources. Support for up to 75 Boston veterans to access a variety of legal services and counseling through the Veterans Legal Services, and funding for up to 30 veterans to access educational opportunities at the North Bennett Street School in the North End. 50 veterans and their families in Charlestown will be able to obtain memberships and attend programs at the YMCA. In collaboration with the Bullpen Project, we have also been able to access numerous applications for our veterans to receive emergency assistance. The Boston Bullpen Project provides specific support at critical junctions for struggling families and individuals and is committed to meeting these urgent needs with the ultimate goal of improving the overall quality of life of our veterans. So these are just a few examples of the broad reach of our grants program, and I look forward to continuing to work with our community partners to make an impactful difference in our lives, in the lives of our veterans and their families. I also would like to recognize the staff at the Office of Veteran Services. They are at the forefront in ensuring that our veterans and their families' quality of life is what it needs to be, and I cannot be any prouder of the staff and how they work tirelessly in taking care of our veterans. I also very much look forward to continuing working with each and every single one of the City Council members to ensure that our veteran service members and their families have access to all the benefits and services that they have earned. Again, Councilor Flynn, thank you for your time and all the work that you do, not just for our veterans, but for our neighbors here in the City of Boston.
Thank you, Commissioner Santiago, and appreciate you being here and the work you and your team are doing. Let me go directly to Director Ng, who's at the VA, Federal VA in Jamaica Plain. Director, it's good to be with you.
Okay, can you hear me? Just testing.
Yes, we can hear you, Director.
Okay, thank you. So first of all, let me thank Councilor Flynn for putting together this meeting. And I see that I'm among friends with Comini and Commissioner Santiago. They are just great partners with the federal VA healthcare system so that we can provide the best service to our veterans. Today, especially focus on women veterans. So I'd like to spend the next few minutes to give you an overview of the services and also improvement that we have made at the federal level, especially the Boston VA and all the VA here in the state of Massachusetts. VA Boston has pioneered research and program development for veterans who are women, LGBTQ+, who have experienced homelessness and addiction, or who have other complex needs. We are fortunate to be in a community where we have collaborations and enhance our services. The number of women veterans serving in the military and who are subsequent veterans is indeed rising. The VA has been very intentional about cultivating a welcoming environment that provides gender-specific medical, mental health, and social care. We tailor outreach such as our town hall to women veterans. The VA Women Veterans Program Manager, Carolyn Mason-Wally, who is online here, meets monthly with the Women Veterans Network and collaborates to meet the need of women veterans. We also work hard to gain our veteran trust at VA Boston. So one of the major indicators at the VA nationwide and Boston is to survey the trust level of veterans in using our service and trusting our providers, trusting our service to provide the best health care to them. At Boston VA, our trust level is close to 94%, which is one of the highest in the nation. Our women trust level is a little bit over 89%. So you see that there's a gap there. That although it's only a few percentage point difference, we know that there is more work that we need to do to gain the trust of women veterans. And we are keenly focused on doing a better job in that area. Now, with this high trust score, this has resulted in an increase of more than 600 women veterans enrolled at VA Boston, and thousands come throughout the region and the country to receive specialized care from us. The rate of unique veterans women treated at the VA Boston has risen 33% in the last 10 years to more than close to 4,700 veterans, women veterans. At VA Boston, our service for women veterans include women health primary care providers, trauma-informed care, maternity care coordination, women imaging suite for mammogram, bone density assessment, and transvaginal ultrasound right at Jamaica Plain. And of course, women veterans are served within all programs at VA Boston by staff trained in unique needs of our women veterans. Women veterans are most vulnerable to homelessness and poverty than their civilian counterpart. And the cost of living and childcare in Massachusetts is a factor. VA Boston has short and long-term residence programs for women experiencing substance use disorders and homelessness. Our Boston HUD-VEST team help women transition to support housing with their children. It is a frequent challenging to find shelter for homeless veterans who have children and pets, and in an area that increases her feeling for safety. We are working hard to find more housing within the city of Boston, but I don't have to tell you that the rental rate is quite extensive, quite high, and frequently we have to go a little bit beyond the city of Boston. But we do find housing for women that have children and pets. VA Boston administers multiple programs to address the needs of our returning veterans and those experiencing other unique needs. Our primary care service have patient-aligned care teams, have social workers who help to identify veterans' needs and increase access to care, transportation resources, advanced directives education, assist with navigating financial aid and medical bills, and strategies to navigate veterans' benefit like service connections, housing, GI bills. Our post 9/11 military to VA case management program supports returning veterans through robust outreach, a walk-in service, enrollment support, education, and job fair. Our collaboration with community organizations include the Massachusetts General Hospital Home-Based Program, the Intensive Care Program, Veteran Support Partnership Network, and Massachusetts National Guard and the Reserve are important components of these services. VA Boston is a leader in research and service for our LGBTQ+ veterans. An interdisciplinary team of 4 LGBTQ+ veterans care coordinators facilitate patient care and staff training. Our disciplinary transgender treatment team facilitate access to gender-affirming medical and mental health care. VA Boston was selected by the National LGBTQ Program to pilot new medical records advancement designed to better assess the needs of LGBTQ veterans. Since 2013, VA Boston has received the highest possible mark among VA from Healthcare Equity Index, HEI, a tool used to standardize the evaluation of policies and practices related to LGBTQ+ healthcare access and equity. VA Boston Healthcare for Homeless Veterans conduct outreach in shelters, on the street, collaborates with homeless service providers, and provide a homeless walk-in clinic and stand-down. Our homeless veterans community employment specialists provide employment services and a readiness program. Our Housing Urban Development Veterans Affairs Support Team provide subsidies and project-based housing, voucher plus case management. We work very closely with the City of Boston on all this HUD-VEST voucher, which is extremely successful. And next year, we're going to get more voucher to support the city and other surrounding cities near VA Boston for additional housing. Our grant per diem transitional housing for veteran programs are conducted in partnership with community providers. We contract with shelters. A great partner is New England Center for Homeless Veterans, right there at downtown, right across from the City Hall. And there are 9 apartments on the top floor for women veterans. And those are supported by HUD-VEST voucher, which is a tremendous partnership. VA Boston provide comprehensive service to address the need of all our veterans, and we continue to enhance these services with world-class research and innovation. So what's coming up? We are continuing to expand IVF, in vitro fertilization service, and also going to provide child care service for women veterans when they have appointment with us. Those are forthcoming in the next couple of years. Our strategic collaboration with community partners continue to be a top priority. We appreciate the dedication to veterans and look forward to our continued partnerships. So I'd just like to mention one thing that has going on right now. Every year we put on the summer games for disabled veterans, and we also put on the winter games up in Vermont for skiing and other winter activities for disabled veterans. It's one of the largest ones besides a VA national game. The summer game is taking place this week at Rhode Island, where we have find various sites for summer games like sailing, bicycling, kayaking, and many things that disabled veterans may believe that they need some help to get back into not only physical ability, but also mental readiness for their challenges. And that's what we focus on, the whole health of the veterans. This year, of the 45 participants, there are 14 female veterans participants, the highest ever, close to 40%. So we're very proud of what we do in the federal VA, at Boston VA, up the road from Bedford VA, and also Central Western Mass VA in the Worcester and Northampton area. So let me stop here, and again, thank you for this opportunity to testify in front of you, Councilor Flynn. And I'd like to thank you for your service of Commissioner Santiago, and your advocacy for veterans, and especially women veterans today. Thank you so much.
Thank you, Director Ng. Thank you for the leadership you have provided and your team as well on so many critical issues impacting veterans and military families. At this time, let me ask one of the national officers at the Disabled American Veterans United States Marine, former Secretary of the State Veterans Services, Coleman Nee, to testify now as well.
Thank you very much, Mr. Chairman. It's an honor to be here today. Thank you for asking us. Always an honor to be with the Commissioner from the City of Boston, my good friend Rob Santiago, and both of you Navy and DAV members and Navy veterans, and always great to be with you, and certainly and the good work that Rob, that you are doing up in one of the most innovative departments that I've seen, not just in the Commonwealth but nationally. So thank you so much. Also great to be with my good friends from VA, Mr. Ng, Carol and Mason Hooley. Mr. Ng, years ago, I used to come in about 3 or 4 times a week to have meetings at the West Roxbury VA, and now I come in about 3 or 4 times a week to have appointments at the VA. So it's the cycle of life. But I will just mention this as an aside, because many people ask me what my opinions of VA are. And as far as VA healthcare goes, I have options in my healthcare. I've been fortunate enough in my life where I have options for how I get my healthcare. I exclusively choose VA. It is an amazing healthcare system with amazing professionals. I've never been treated with anything less than proficiency and competency and respect. And I really appreciate the hard work that the men and women do who work for our VAs here. So thank you very much, Mr. Ng, for keeping that commitment. I do represent disabled American veterans, Mr. Chairman. And I do have to one, clarify my remarks, or at least put some context here. When discussing women veterans, I especially am one who believes that if you want to know what a woman veteran thinks, you should ask a woman veteran. Unfortunately, the timing and the summer vacation schedules and such that surrounded this hearing did not allow us to have someone come in who was from our Women Veterans Committee. So, while I cannot speak directly to the experiences, I can tell you what we have seen, the data has shown, and I would certainly recommend that whether it be in a committee setting or in the field, that you move to meet with women veterans if you really want to get their perspective. Having said that, again, on behalf of DAV, it's more than 1 million members nationally and over 28,000 here in Massachusetts. Thank you for inviting me to provide testimony. All of our members are wartime disabled veterans who were either wounded, injured, or made ill during their service. They utilize the Department of Veterans Affairs benefits and the Veterans Health Administration at an extremely high rate, and in fact, many depend on VA as their sole source of health care. Throughout its 100-plus years, DAV has been an unwavering champion of women veterans and has made a concerted effort to highlight and recognize their contributions to the defense of our country. The integration of women into every career path in the armed services has resulted in a rise in the number of women who serve and subsequently increasing numbers of women who have applied for disability benefits and enrolled in VA healthcare following military service. Women, in fact, are, as it was mentioned, the fastest growing demographic of veterans, with over 650,000 now using VA healthcare services. Women veterans use VA healthcare services at high rates for service-connected disabilities, and many have medically complex health histories and use specialty care, such as mental health and substance use disorder, at higher rates. Unfortunately and tragically, too many of our women veterans' untreated mental health issues have led to a rising suicide rate amongst this population in recent years. About 2 years ago, DAV began work to review all available medical research literature concerning mental health among women veterans populations, particularly focused on gaps in care and solutions to provide services. And in February of this year, DAV released our newest report, Women Veterans, The Journey to Mental Wellness, with our findings and recommendations for change. This report is the third in a series of reports on women veterans DAV has released over the past decade, but the first one that is dedicated to mental health. Our report is a comprehensive look at the unique risk factors contributing to the staggering rate of suicide amongst women veterans, and how the VA and frankly, national service organizations and city governments can and must do better. In addition to identifying gaps in gender-tailored mental health care and suicide prevention initiatives, DAV offers more than 50 national legislative and policy recommendations that have the potential to save the lives of women veterans. Mr. Chairman, I will submit that report in its entirety to the committee to share. Essentially, the bottom line, the report comes on the heels of the VA's most recent annual veteran suicide prevention report from November 2023, which is based on the most recent data and analysis from 2021. And despite what it is a positive development of a public health approach and concentrated effort to reduce suicide among veterans, VA's report showed increased rates of suicide for veterans, and showed increased rates of suicide for veterans. And the most alarming finding was that the suicide rate among women veterans jumped from 24.1% in 2021, jumped 24.1% in 2021, nearly 4 times higher than the 6.3 increase among male veterans, and vastly higher than the 2.6 increase among non-women veterans. So to address this, DAV makes over 50 policy and research recommendations intended to spark necessary and urgent change that can save lives. Locally, I think there are a few things we can do, including one, recommitting to the President's Governor's Challenge in partnership with Substance Abuse and Mental Health Services Administration to promote evidence-based state or community interventions to prevent veteran suicide, including community engagement and partnership coordination with the Department of Veterans Affairs. I would say looking at the city's budget, looking at the good work and outreach that Commissioner Santiago has done, I would certainly think that there would be room for increased funding as well as new programming, not just with Veteran Services, but in order to coordinate the city's Department of Veteran Services, our Office of Veteran Services, with other city agencies like Department of Public Health and the Women's Commission, as well as VA, to essentially coordinate efforts and also spread the word and be able to use that as a force multiplier to achieve a better result. And finally, I would say that it should be incumbent upon all city officials, as well as I know Commissioner Santiago does, but to understand that our women veterans are a unique population. Many have not had positive experiences throughout their entire military career or veterans or time as a veteran. And these are veterans who may be somewhat reluctant to self-identify as a veteran. They may be somewhat reluctant to join what they see as sort of male-oriented organizations like veteran service organizations or other things like that, and tend not to attend the celebrations or demonstrations of veteran pride that occur for many good reasons. So I would suggest that more and greater effort need to be made to reach out to these veterans, these sisters in arms, these women who bravely stood up and served their country, and to give them a pathway and an access to resources, understanding that they are living right now sometimes outside of the realm of our usual outreach efforts, and to ensure that they get the care and services they need in the way in which they want them provided, and to make sure that we are all culturally and gender-specific trained in knowing the specific issues and challenges that our women veterans face, and also making sure that those veteran challenges those challenges and issues get addressed. So with that, Mr. Chairman, I'll conclude my testimony. Thank you so much.
Thank you, Coleman, for your testimony, for your important work, for the important leadership and work, as well as for the disabled American veterans. We are anticipating State Senator Lydia Edwards, who's currently in the Army Reserves and is the daughter of a retired Air Force sergeant, I believe. She is going to be here with us shortly. I know she'll have some perspectives on women veterans, and Commander Mary Dith Tuitt from the Carter Post as well. She has joined us. Oh, thank you, Shane. Let me take this opportunity to go directly to Commander Tuitt. At the Carter Post in Mattapan on Blue Hill Avenue. Commander Tuitt, I know you've been active in supporting women veterans and their families for so many years. Can you talk about that experience as a woman veteran, and what are the challenges you see going forward, and how can we work together to address these issues?
Good morning, everyone. Sorry, I'm at a conference down at Suffolk University for a national organization, so that's why I'm doing virtual. I'm excited, and I want to thank you, Chairman, for allowing me to call in and speak about veterans issues, and especially veterans of color here in the city of Boston and the Commonwealth of Massachusetts, and female veterans. There's so much. When we always were excited to be able to join the city of Boston, our city councilors, and of course my comrade and colleague from the Navy here, when we have the ability to speak on issues that are impacting veterans, especially here in the city of Boston. One of the things that we have been working on, and I hope we continue until we get to a solution, is how do we service our veterans who are having food insecurity, but most number one priority, homeless issues. And not homeless on the streets, but lack of being able to have housing that they can afford to be in and stay in, stabilized housing, right? Many of our veterans struggle because, one, they might not be able to have a high-paying job. Their family and their life is here in Boston, and they want to remain in Boston, but housing cost has gone up so much and continue to increase annually that it is hard to live here in Boston as a veteran. And many of us know that right now, a room might cost you $900 to $1,000, and that's just a room. So what do we do? How do we help our veterans? And one of the things that I hope that the city of Boston will be able to look at is retrofitting, get an empty building, an empty warehouse, get something that the city of Boston owns or can own. Find veteran organizations such as the American Legion, the VFW, African American Veterans Association, the Triad Veterans, and see if we can pull together and make a consortium and create single studio apartments in an empty building somewhere that we can house our veterans, that our veterans can be off the streets. And the ones that do need the mental health care and so on, be able to have some type of assisted living, some type of therapy or counselor attached to that home, you know, where they'd be able to have conversations and get the support or medical support, but still live on their own and be independent. And that's one of the things that we are lacking in doing here in the city of Boston, is assisting our veterans to be stabilized in their housing atmosphere and be able to have a better life through a roof over their head. You know, just as we raised our hands and committed ourselves to the United States of America, I truly believe that we, as advocates for our comrades, we should be able to raise our hands and lift a roof where they can be able to live comfortably and properly. You know, I have so much more that I could speak about for veterans, especially veterans of color and female veterans here in the city of Boston, but that's my priority, is to be able to get this onto your books again. So let's talk about how we can work together collaboratively to create housing, stabilized housing for our veterans, you know. And I want to thank you so much for letting me be able to come and speak. As I said, I'm just popping in for a few because I'm at this national conference here, but it's always a pleasure to speak up and speak on behalf of the needs of our veteran community.
Well, thank you, Commander. We're honored to have you with us. We have great respect for you and for your service. So thank you, Commander, for your leadership that you played throughout the city, really throughout the country as well. At this time, we are joined by City Councilor Tanya Fernandez-Anderson. Thank you, Councilor Fernandez-Anderson, for joining us. Would you like to give an opening statement?
Sure, thank you. Councilor Flynn, thank you for chairing and for sponsoring this conversation. I just wanted to thank the panelists for being here. Such an important conversation. Senator Edwards, I know that you'll get your proper introduction soon. As a Marine mom, I take it personal in terms of how serious service is to me and for our veterans, the sacrifice that they make, especially to this conversation in terms of how the city can better serve them. I was very interested in what Commander Meredith Tuitt had to say, and look forward to hearing more and learning about the current state of things and how I can be of support to ensuring that we are taking care of our veterans. Thank you.
Thank you, Councilor Fernandez-Anderson. I'd also like to recognize another member of the panel, a former city councilor, a current state senator from Boston, a member of the U.S. military, and probably most importantly, in my opinion, is someone who is the daughter of a veteran and understands as well as anybody the impact service has on a family and challenges a family has when a loved one is overseas or moving from base to base, but someone I respect not only as a veterans advocate, but as a leader on so many issues in the Commonwealth. Councilor Edwards, honored to have you, and just wanted to get your perspective about support for women veterans, and also maybe generally speak about what are you doing up at the State House on veterans issues? How are we supporting our military families as well?
Thank you very much. Once a counselor, always a counselor.
Yeah.
I'm honored to be here today. As you mentioned, I am a member of the United States military. I want to be clear that as I'm speaking, while I am Lieutenant Edwards in the Army National Guard here, I'm not speaking on behalf of the National Guard or the military, but I am speaking from my experience, both as a military brat and as a current member of the JAG. So just a perspective is what I'm providing. So I want to be very clear that a lot of what we have been providing for women veterans, women military members, is oftentimes, it has grown a great deal in terms of what we've been able to provide. It has grown in terms of its understanding that it cannot be just the exact opposite or almost what we're providing to a lot of our male colleagues. I'll give you an example. Traditionally, when soldiers deploy, there's oftentimes a support system that supports the family. But oftentimes that support system is assuming that there's a woman who's there with the kids. We're seeing increasingly there are more men who are staying at home with the kids while their wives or their partners are deploying. And we also have more gay and lesbian couples as well. So the gender roles and our understanding of how to support families need to also change as well. And talking about dependence in a gender neutral way that is inclusive of all ways in which families come, because all these families are serving the military. That's one thing I'd like to say. Another thing that is very important is to acknowledge that housing, as I think it was Meredith was talking about, is a universal issue and theme that you find for all veterans. When visiting the New England Center for Homeless Veterans, I had the opportunity to walk through it and have a tour. There was a wing specifically for women, though, just for women. And it's because of a pervasive issue of sexual assault. And when I asked what the percentage that the director felt of the women who had been assaulted, he said almost 100%. And it is still an issue that is pervasive through the military and inspired me to become a JAG officer. And in part, it's really important that we acknowledge the traumas that soldiers face, not just are from the battlefield, but also different internal battles based off of the traumas they experience as being a soldier. And we need to curtail and make sure as we welcome them home, their stories about what happened to them or what they did are accepted as their story, and the healing and the therapy is provided with no judgment. And when I believe it was Rosemary who came and testified and talked about her own experience, veteran, does the veteran services in Winthrop, she talked about coming back after being assaulted, and they told her because she was a military police officer, she should have done something better to defend herself. That was the welcoming she got home. So again, I'm here to talk about, and this is not an issue, I believe, in Boston, but not every veteran gets to just come home to Boston, right? This is about this is a statewide concern, and it's important that when we welcome them home, we're cognizant of traumas that happen. Finally, Councillor Flynn, there's 2 areas that I'd like to note that we're working on in the State House. Currently, the HERO Act, which is an act that was passed by the Senate and the House, which is dealing with all things veterans and military members. There are various areas in which we're trying to make sure that these service members are treated with respect and dignity that they deserve. 2 areas that we have been open about our concern is regards to legal issues from the JAG. One is concerning sexual assault. Right now, we have our own, and a lot of people don't realize this, Massachusetts, when you have a National Guard, like any other state, we have our own military code of justice. We have a state-level code of military justice and laws that we look to as lawyers for the prosecution and defense of soldiers and advising of our generals. So in our code of military justice, sexual assault has a 2-year statute of limitations. For those who are watching and don't know, statute of limitations, I know you all know, but I'm assuming some people, not everyone knows what statute of limitations means that that's the amount of time you have to prosecute a sexual assault. It's 2 years. Issue that we have also is that the 2 years starts at the day of the assault. In some cases, it could start the day that the soldier comes forward, which would be helpful and allow for those of us who are interested in prosecuting and investigating to have the time we need. So that's one amendment we actually have pending. I would love maybe to get the support. It's pending right now in conference committee to make sure that we can truly have the time we need to prosecute and at least investigate these crimes. What we're finding is one too many. When we go to say, hey, we think this is happening, the person knows, oh, they're coming after me. They retire with full benefits, honorable discharge, and we can't do anything. So more time. That's one thing. The other thing that we're very excited about noting and want to continue the fight for is the VERB, which is the Veterans Equity Review Board. I want people to know, and I'm sure a lot of you may know about this valuable resource, and that is simply that when veterans, military members were horribly treated under Don't Ask, Don't Tell. And we set up this state review board to assure that those veterans who were discharged, oftentimes dishonorably so, under Don't Ask, Don't Tell, that they can come back to the state under the VERB and seek their benefits as though they had been discharged honorably. Mm-hmm. Very proud of that. And we want to make sure that that maintains, and I wanted people to know about that resource. And so again, we want to continue to make sure that it's narrowly tailored for Don't Ask, Don't Tell survivors who were dishonorably discharged, and as a result of that, were denied all benefits, all veteran preferences and housing and so on and so forth. They're denied that because of Don't Ask, Don't Tell. And so the VERB exists for all of them to come forward and say, that happened to me. And it's not just a giveaway, right? We're going to assess and make sure, excuse me, little hair, it's coming again. We're going to make sure that we have all of the records there, that it was because of that reason, not because the person had other issues, and then assure that they're given their state benefits. And I want to thank Major Vilas, but also Senator Vilas. That was his idea, and that came to fruition. Pending now also are two things, and the housing bond bill that are still pending and would love advocacy. One is a working group on tiny homes and small homes for veterans and trying to figure out how we're going to creatively house veterans throughout the entire state. The other one is a veteran preference for housing. So if a city or town has inclusionary development, like the city of Boston does, I think it's to like 20% and all of these different things. We have an inclusionary zoning policy. If this passes, the city or town would be able to add veterans to the list of populations that get preference in that inclusionary zoning. So that is pending. By that I mean it's not the law yet. Mm-hmm. And I'm encouraging people to, if there's something you're interested in, I'm on the conference committee, we're accepting testimony and excitement and so on and so forth. So we're very keenly aware housing is part of the dignified return that every soldier deserves. And we're keenly aware that so is therapy, so is healing. All of that is part of the dignified welcome home that veterans deserve. And I just wanted to come and voice that. And thank you so much for the invitation, Councillor Flynn, and that's all I have.
Thank you, Senator Edwards. We're honored to have you here and for the important work and leadership you provide. I also want to recognize City Councilor Erin Murphy for being here. Councilor Murphy, would you like to offer an opening statement?
Thank you. Thank you, Chair. I'm sorry I'm a little late. I was at the ribbon cutting at the Charlestown Clarity Pool, and the mayor hadn't even showed up yet, so I had to leave. So I did miss it, but I made sure I got back here in time. Thank you for this important hearing. As we know, and I know Commissioner Santiago, you do amazing work, but we have to make sure our veterans know what resources and services are out there and making sure that we're connecting them. And at your level, Coleman, thank you for all you do. So just here to see how I can be more of an advocate supporting our veterans across the city, across the state. You know, my dad, a Marine veteran, pilot in the Marines, and my son's going off, and we're counting down the days now, less than 3 weeks, where he'll be going off to the airborne infantry training. So excited for that, knowing that, you know, we're a city where we respect our veterans, right? But we can do better in making sure that we're advocating any way we can. So thank you for this, and looking forward to the conversation.
Thank you, Councilor Murphy.
Thank you.
I know Director Ng may have a time limit, and I do want to give him the opportunity to maybe weigh in on some of the comments that he heard before he has to depart and offer any closing comments that he had and how we can work together and how can we address some of the challenges expressed by the panelists here today. But Director Ng, I do want to give you an opportunity to weigh in before you have to depart.
I believe Mr. Ng had to jump off already. We had 11 o'clock hard deadline. But my name is Carolyn Mason-Wally. I'm the Women Veterans Program Manager for VA Boston, and here to provide any answers that you may need, or take down any questions that you might have that we can follow up on in the future.
Well, thank you for being here with us as well. Let me ask my colleagues that are here from the City Council if they want to ask any of the panelists questions. I will withhold my questions at this time. I will start with Councilor Fernandez-Anderson, and she can address her questions to anyone on the panel or on Zoom as well, and then I'll go to Councilor Murphy. I do want to recognize a good friend of mine, Haywood Fennell, who's an outstanding leader in the veterans community. Haywood, it's good to be with you. At this time, let me ask Councilor Fernandez-Anderson if she has any questions to the panel.
Thank you, Councilor Flynn. Senator Edwards, really excited to hear all of the work that you're doing in the state, and I really appreciate the conference committee in terms of figuring out inclusion zoning and how we can do tiny homes. I'm a fan of tiny homes. I looked into some, laser cutting sort of companies to come in to start working with Chief Dillon to work on tiny home projects here or in District 7 in Roxbury, considering how many parcels we have. So a lot of opportunities there. And just my mouth dropped when you talked about the stats in terms of, how many women actually experience some level of sexual assault or even harassment in the military. And it's just disheartening. I was a intensive care mental health practitioner for 11 years and had a lot of clients that through the VA and outside in Department of Mental Health that I had to work with. So it's just truly disheartening to hear that. I did want to understand on the city level if there were things that you could possibly think of or potentially be open to in the future for us to work with. I'm very interested in supporting whatever way I can.
Thank you. I have to say you have some of the best advocates here on the city level when it comes to welcoming home veterans. As I mentioned, I think on the city level, there's many levels that a veteran is welcomed home. You have federal, you have state, and of course you have city, which I think impacts veterans more directly than any other level. Federal being the VA, but and I've seen Commissioner Santiago
Step up.
Not just step up, but step out proudly and express who he is completely. And I think that's so very important. As I mentioned, don't ask, don't tell. As I mentioned, so many ways in which the military has been inclusive. It has also excluded people and has discounted levels of service, found them less worthy than others. And so when people come home, the city needs to celebrate them just as much, if not even more, just as much. That service to country comes in all colors. It comes in all forms of families. And when you do that, when you celebrate it, then you also can't just do it on the superficial level. It is acknowledging sexual assault is a problem for women and men, honestly. A lot of men are coming forward as well. And so when we do that and when we talk about that and understand the city's role is about healing and transitioning into civilian world and life. And that bridge is where we lose a lot of veterans. It's where we lose a lot of service members because the transition is sometimes the hardest. It's when the breakdown from what happened down country comes out. It's when the rhythms of what you've known for years are disrupted. And so to meet somebody where they are, to help them develop a new rhythm, new set of skill sets, not just give them preferences, which I'm not opposed to, but if you're not ready to receive the housing, right? Because you can't sleep by yourself because you're still dealing with trauma. If you're not ready to receive or be in the job where you have responsibilities, if you're not ready for that, that means you weren't fully welcomed home. And so, thank you. Thank you so much for your work.
Thank you, Senator. Commissioner?
Yeah, if I could add to that also, I am vigorously in the process of filling a new position, the Integration and Transition Advocate position here in the city of Boston, because everything what the Senator just said is very true. I myself, a 20-year veteran of the United States Navy. When I retired, I felt I had my foot in the door, but what was expecting me on the other side of that door, what was the big question mark. I thought I had that parachute, if you will, which I did, which thankfully I had at the time my fiance, my now husband, to support me. But this position is very near and dear to me. And I want to ensure that before this position is filled is a person who understands that transition, a person who he or herself has integrated into the community, and I want to ensure that that individual is also a veteran. We do have a couple of good folks that have interviewed so far, but until I am perfectly sure that this individual is going to fill that role in the way I foresee it, it's going to remain vacant until I find that right person, because it is hugely important to the psyche of that veteran, to the mental health of that veteran and their family as well, to ensure that we're helping them get the mental health resources that they may need, or housing resources that they may need as well, and to be there beside them when they go through that transition, when they integrate back into the civilian community, and to also to ensure that the civilian community is there to assist them as well, because that's a big part of it. Because these veterans that are coming in, these service members that are not transitioning into veterans, they need to be welcomed back into the fabric of the community that they're entering, and that's part of what this position is about. That's part of one of my biggest visions in this upcoming year, to ensure that every veteran that comes back into our community is taken care of by the city. But also those that have previously been incarcerated or about to leave incarceration, who are veterans, ensure that we also reach out to them and letting them know that this Office of Veteran Services here in the city, along with returning citizens, are there to ensure that they get the resources, benefits, and the help that they need to be able to transition into the community.
Commissioner, thank you so very much. As Senator mentioned, not only do you step up, but you step out into your identity and bravely represent and support our veterans. It must be heart-wrenching in public safety institutions or veterans, military. You see this sort of trend or culture, right? Whether because you were Black or LGBTQ. So to be in your position, and to be so bold and yet so humble and so kind, always. We thank you for your service and your work here with the City of Boston. I did want to ask you about the GAP mini grant. Just, casual conversation here. I want to understand, how's it going for you? How many applicants would you say? Or could you use more? Could you use support or building capacity? Is that going to help you, and how do you foresee it getting better?
Thank you for that question, Councilor. It went great. I thought it was a success. We had 21 applicants that were filed. We approved 13 of them, and it is a full scope of services that we're able to give into the community. Everything from employment to life skills to mental health. To even legal services as well for our veterans, and also access to the YMCA as well. And also to traditional schooling with in the North End at the they're escaping me, the Bennett School. So we were able to have 13. I think it was a little bit over $100,000 that we were able to approve for this cycle. We're looking at, now that we went through this first phase, the first time that in Veteran Services that we've had a mini grant program, we're looking at expanding it for this upcoming fiscal year as well.
Thank you. Mr. Chair, do I still have more time? Thank you.
Yes, Council, you do.
Thank you. On the Veteran Service website, there's a survey asking people for specific demographic information. Could you tell me, have you guys been able to aggregate that at all?
Not quite yet. We're waiting for at least 5% to come in, so we will be able to aggregate all those numbers. We're not quite there yet. When a veteran does come into our office, they're told to fill it out. Some of them, quite honestly, don't want to fill it out, but the ones that do fill it out, we have been able to put them into the system. And when we go to events, continue to go to events, we will be taking hard copies as well as have it online as well, so we have veterans fill them out.
Appreciate it, thank you. Veteran Service has a food assistance form. Does your department partner with food service or food justice?
Yeah, we do work in collaboration with them and also the Greater Boston Food Bank.
It's also other nonprofits.
Yes.
Thank you. And then a question on MGL 115. This financial assistance for veterans can be used for prevention of homelessness. However, in order to qualify, you must be able to prove Boston residency. And if unhoused veterans are not able to do that for one reason or another, are they still able to get other type of benefits or be eligible to get service?
We help them in every which way we can to provide the residencies that they need. A lot of times, the reason the residency requirement is there is because MGL Chapter 115 covers the whole state as a mandate from the state. Mm-hmm. So when we pay it out, it comes out of our funds, the City of Boston Veteran Services. But we do help out the veterans to help them with the residency.
Okay. Mm-hmm. So there's the MGL supports, and then there's some city funding. Do you get anything outside of that? Any other grants or?
Well, we do work with our nonprofits like the New England Center and Home for Veterans. They've been a big help in ensuring that veterans are housed in one form or another. Also with Rosie's Place, and also through Chief Dillon's office. Also, they've been a huge help with us to ensuring that our veterans are taken care of.
Would you say that there's some sort of priority given to folks when you do refer them to outside entities?
When they come to our office, they are a priority.
But to, for example, Rosie's Place, do they have that mandate in their applications or?
Well, when we talk to them, we ensure that they know that this person is a veteran. As far as what their process is something that I need to really talk to them about. But whenever we do talk to Rosie's Place or Pine Street or the New England Center, they know that it's coming from Veteran Services, and they do prioritize them as best as they possibly can.
Thank you. I have further questions on more structural side of the programs, but I can yield and wait for my next turn. Thank
Sure.
you.
Yep.
Thank you, Councilman.
Thank you, Councilor Fernandez-Anderson. Before I go to Councilor Murphy, I do want to give Carolyn and Coleman an opportunity to kind of weigh in on the questions Councilor Fernandez-Anderson had, if you want to provide a response. Let me go to Carolyn. If you have an opportunity to respond to some of the comments and questions from Councilor Fernandez-Anderson, I just wanted to give you the opportunity.
Okay. One of the questions that was resonating with me was the question about welcoming veterans home after their military service. And it's something that we have worked on at VA very strenuously, particularly in the Women Veterans, Office of Women Veterans. We had developed Women Veterans Transition Training. Basically, it is that can be held either online or in person, and we've run it several times in the Boston area, and continue to make it available. They have now turned it over to us locally, to the Women Veterans Program Managers at each VA. And it is available to hold at any time. So I will offer that as a resource. And then I think Commissioner Santiago was talking about getting out there and doing outreach. Definitely we are trying to be there anytime any organization comes back, the National Guard comes back from deployments. Our post 9/11 military to VA case management program really supports that population very well, providing really robust outreach, a walk-in service, enrollment support, and so on. Job fairs are also a part of their the work that they're doing. So constantly trying to get out there. There's a whole team of us that does that. So we are willing to help anyone in the city of Boston that is in need of such services.
Thank you, Carolyn. The National Officer from the Disabled American Veterans, Coleman Nee, would you be able to respond to some of the comments and questions from Council Fernandez-Anderson?
Yeah, thank you, Mr. Chairman, and thank you, Councilor, for the question. I did want to preface this with something I said at the beginning of remarks. I don't think you and Councilor Murphy had a chance to join us at that point. But I do want to be very clear, because of the timing of this hearing, I am representing, but ordinarily we would have someone from our Women's Veterans Committee representing. I don't want to pretend that I can tell you about the experiences of our women veterans, but I am honored and privileged to share what they've felt comfortable to share with me, as well as some of the data. And I think when it comes to identifying veterans who are marginalized or underserved for many reasons, a lot of that, particularly with women veterans, may come down to negative experience they had in the military, and maybe in their initial interaction with any type of veteran services, be it even a veteran service organization or healthcare or city or state benefits, and for the women that are affected, particularly with MST or survivors of MST, what is, I think, to me, one of the things that I can sort of contemplate and relate to is the fact that I can look at my military uniform with pride that's hanging in my closet. I can't tell you I would fit in it, but I can look at it and I can look at it with pride. I think for many of those women, one of the biggest tragedies is that they look at something that was going to be such an important part of their life and such a cornerstone of their pride and their commitment to their country, and now look at that uniform as a reminder of trauma or a tragedy or something that they've had to deal with as a result of their service. And so those are, many of those folks don't self-identify as veterans. Many of them do not join vet service organizations. They don't attend. They don't go to the parades or the veteran ceremonies or things of that nature, and they sort of suffer alone. And I think one of the recommendations that we would have, both at I am submitting a report to the council that DAV has just done on the journey back about women veterans healthcare, mental health care at the national level. But at the city level, it's more coordination amongst different agencies where women may not go to get veteran services, but they may bring their children to a health center. And are we identifying, did you serve in the military? Would you like confidential benefits? Things of that nature on intake forms. They may access other city benefits. They may access public housing in the city of Boston. Are we asking the question, did you ever serve in the military? Would you like benefits, or would you like confidential assistance or peer outreach? Things of that nature to try to, and those are just creative, cost-effective ideas. But the more people we reach with the right person to reach them and credential, that it doesn't have to be the way that maybe they experienced it the first time, will allow for an increase in services and resources that will allow for better outcomes in terms of, how they live their lives and their family lives their lives. And I think would help us to provide a lot more support to whether it's women veterans or any other underserved population that feels like they've been marginalized or not treated equally.
Thank you. Commander.
Counselor, if I could just reiterate something very important that Coleman said. I think it's very important to also on a lot of these surveys and these questionnaires that is asked, did you serve in the military, just the same way Coleman has said, as opposed to, are you a veteran? Because there are a lot of people out there that don't recognize themselves as being a veteran, although they may be, but the way to go around that and circumvent that is to say, have you served in the military? So that's an important thing to note.
Thank you, Coleman D. Before I go to Councilor Murphy, I do want to give an opportunity to my friend Haywood, an opportunity to introduce himself. I know you're doing a lot of exceptional work in the communities of color supporting veterans, but we have great respect for you. Enjoy joining you for coffee once in a while in Nubian Square. And I think you invite me all the time because I always pay for coffee for you, you know. One of these days you're going to have to take that $5 out of your pocket and buy me a coffee. But honored to have you, Haywood.
Hey, thank you so very much for inviting me here today on this panel to discuss some things that need to be discussed. I'm not a pest. I just want the best for our veterans. That's all I want. I want us to understand that serving our veterans is not a one-shop stop. It is a collective of agencies that work with veterans and their families. And when I say veterans, there are a lot of people that do not consider themselves as veterans because of the way that they were treated when they wore the uniform. I work like a bivouac situation because I'm in the community, you know, and I meet veterans in different places, different spaces, and courthouses and no houses and on the streets. I've been doing this work for a long time. Coleman was a young guy working for the Secretary Kelly.
Yep.
When we did the scientific survey that showed the discrimination and the lack of cultural sensitivity at the VA hospital. And we're still working on that situation. I don't want to compare myself to the work that these honorable people are doing, but let me just say that I am a disabled veteran who challenged the registry people about excise tax payment that denied me my license. And it's a law that says that if you are a disabled veteran in the Commonwealth of Massachusetts, you are protected. Now, I went to the disabled veterans, and they referred me to somebody. I went to the office of Robert Santiago, and I didn't hear anything. Maybe they forgot. Whenever a veteran needs services, I refer them. I said that I'm in a bivouac situation. We're better to send them than the office of Robert Santiago for services. I do that. In terms of incarceration, concerns about incarceration, they lifted the court, Veterans Court. We don't have that anymore. And it was really needed in Roxbury with all the drug offenses that we have there. Roxbury veterans are in need of a facility for veterans to come and get taken care of by veterans. We have now a proliferation of healthcare institutions in our community saying that we can do this and we can do that, and they're not veterans. Veterans need to have the opportunity to help veterans. And so I'm just hopeful that the women veterans get what they're supposed to get is respect, because I served with them too, and I know that they went through a lot of things. And I'm just so grateful to know that we had this conversation, because I'm the face of the 3 o'clock in the morning emails that I sent around out of my concern for veterans and their families. And I'm grateful because I've been able, because of veterans' help, pull myself up to be a leader in our community. And I thank you for this opportunity to speak.
Thank you, Haywood, and thank you for your service to our country and for what you do in the community.
Thank you.
Let me go directly now to City Councilor Murphy, but I do want to acknowledge Councilor Ben Weber is with us. Councilor Murphy, would you like to offer questionings to our panel?
Yes, thank you. And thank you, Councilor Fernandez-Anderson. You asked some great questions. But to work off of those, if you could speak to what you would consider the, the needs that you feel like you can't support. Like I know Commissioner Santiago, my office, along with Councilor Flynn and this council, trying to figure out like what more can we do? What do we see when I'm in the community and I'm hearing from residents? And one of the important points you brought up, which is kind of sad though, that there are benefits out there for veterans and many of them don't even identify that way for all different reasons. But when they're not identifying that way because they don't have that pride or feel like it's going to be helpful to them. So how do we, and the idea you had about if it's a checklist at the doctors, asking those questions, they do ask every time I go, I seem like more questions have been added. And one of the things, honestly, I just had this conversation with someone the other day because I recently had my annual checkup and they asked the questions and my question back was, well, if I was to say yes to any of these, are there services available? Like it was an honest question. Like we ask a lot of times in my role too, like, what do you need? What can we do? But do we have the support and the power to then get those resources to people? So what would you consider the services that our veterans need most here in the city?
Yeah, sure.
Sorry, Councilor Murphy, I have to leave in 3 minutes. I was wondering if I can quickly respond. So in terms of services that I'm not speaking obviously on behalf of the city, but there are services that I'm really excited about that the JAG is providing that we'd love to partner, I think, more with the city. One is our yellow ribbon welcoming services. So the yellow ribboning services is literally when the lawyers, religious service members, people with substance use providers, education providers, all of us come together, and there's like literally there's a couple hundred soldiers who've just come home, and we say we're here, and then we line up, and then we wait for them to come to us for any of those services. That's the welcome, the yellow ribbon one. We also have the exact opposite of that, which is right before they go. So we have what we would call a will event. Many of the soldiers know about that though, because they're told like come to do this and prepare. What a lot of veterans don't know is that we partner with law firms throughout the city of Boston and throughout the whole state, where they will just, those lawyers for a day will offer free wills and estate planning for a lot of people. And I think that's pretty important and a great resource. So I look forward to volunteering at those things, and I just wanted to make sure that that was highlighted of maybe some potential opportunity for us to not just go to a law firm, but to come with the legal department of Boston and get the word out for anyone who's ever served to come get a free will. So I just wanted to say that, and I apologize for speaking so fast and cutting. I know, Councilor Murphy, your question was for the commissioner, but I'm unfortunately have to get back to this conference committee. I'm working on a lot of State House business, but it's been an honor, and thank you again, Councilor Flynn, for having me.
Thank you. Thank you, Senator Edwards.
Thank you, City Councilor, for the opportunity for the commemorative stamp series
Yes.
that came out with you and Councilor Flynn. We were working on that to create this commemorative stamp that reflects the 54th Regiment and their contributions in the Civil War, as well as for Christopher Addis, who was the first casualty. So we have a petition drive, and thanks to you, in leadership, we have a lot of elected officials, including the office of the governor, now supporting these images that came from our calendar project, which is a part of our literacy project. Thank you.
Thank you, Hayward.
Commissioner, do you want to?
Oh, so
Sorry, I know she went ahead, but I was asking like the city what we can do.
Well, I think one of the greatest things that I love is the partnership and collaboration that my office does have with all the city councilors here. Whenever there is an issue that your office or Councilor Flynn's office or Councilor Fernandez-Anderson's office or Councilor Weber's office have with regards to a veteran issue, I know I get that email very quickly. And when we do get that email, I do, have my staff look into it and see how we could service and help that veteran or that veteran family member. I think that's definitely, one big way of doing it. Another thing also is to continue to spread the word that this office does exist. One thing that I constantly find, regardless of all the outreach that we try to do, regardless of all the events and meetings that we go to out in the community, there are still some people out there that when they hear veteran services, they think of the VA immediately. They don't think of the fact that the city has their own veteran services office, that we should be the first point of contact for them to see where we could do the warm handoff, rather it is to the VA, rather it is to the DAV or to another organization. So you're getting the word out there that the Mayor's Office of Veteran Services does exist here in the city of Boston. And also, going to Councilor Fernandez-Anderson's point about having additional questions for me about some of our programmatic concerns that you may have, having that conversation. If there's an opportunity for me to sit down with you or with any of the counselors about what we do and what your concerns may be with regards to veterans and their families, I would love the opportunity to sit down and have that conversation, have that cup of coffee. I'll pay for the coffee, Hayward, you ain't got to pay, but I'll pay for the coffee. And when we could have that conversation, so that way, when the opportunity does arise that you are talking to one of our neighbors in the community, that's an opportunity that we could also be able to help out that veteran or that family member.
Thank you. Is there intentionally staffed women at our recruitment offices? I'm going to assume yes, but I'm not sure. Is that something we do at the recruitment level at the offices, that there's always a woman on staff to kind of talk them through if they're considering entering?
Well, we don't staff recruiting offices.
I know it's not directly city, but do you have that information, though? Do we know if?
I do not have that information as far as how many female or women recruiters there are.
Because maybe I would assume if women want, see this as a path, but then the concerns probably are already on their mind, many of the concerns that they think may happen when they're, so if they could be addressed, before even signing on, maybe, I don't know. I do want to uplift South Boston. I mean, their community has done an amazing job with, the Medal of Honor Park and how they've honored their veterans as an at-large city council. Not to say other neighborhoods aren't working hard, but it definitely is a gold standard of making sure in that memorial is looking back at the Vietnam War where we didn't do a good job and trying to make up for past harms. And I do think they go above and beyond to show that respect, and I see that it is taught to our younger generation, so I think that's very important. Do you see how we can do a better job across the city? Like what ways, or what do you see? I know I've been to JP and others, and not that others don't also do great things, but how can we get that out there? Could we have more of a partnership with our schools, our children? I think the important thing about the veterans, and many reason why people may not even consider themselves or say they are a veteran, because they don't get that respect, or then they don't know if people even will respect it here in the city. So how can we do a better job of making sure that?
With regards to honoring and recognizing our veterans?
Absolutely, yeah.
I think in large part the city does do a great job. You mentioned the Medal of Honor Park in South Boston, but there's a lot of other great memorials in the city. In Roxbury, there's a Edward O. Gourdine, Veterans Memorial Park there that honors not just Edward O. Gourdine, but also the Black veterans. And Haywood and the committee, the Edward O. Gourdine committee, played a huge role going back to Ralph Brown, who first started it. Made that happen, and I proudly pass it quite a bit going home. We also have the very first World War II memorial in the country in the Back Bay, and that is going to be renovated. And there in that little area, which I like to call Victory Garden, is also the Korean War Memorial and the Vietnam Memorial. We have the Hero Squares program, the last Hero Square.
Hero Squares are great. Just different ways we can promote those more so people know that. Because there are, when I look on your calendar and I attend. I
Yeah.
try to attend all of them. You do wonderful things. So I'm not saying we're not doing it, but how do we get that out there? So,
Well-
that next generation, because I think it's important. Like at the Puerto Rican flag raising, which is at that wonderful memorial there in the South End, you always see the younger kids, and they just, they soak it up, they take it in, and they
Oh,
see
they do.
that
They
pride
very
that's
much do, yeah.
important to show our next generation of, the wars that we have fought in.
Well, one of the great things, going back to the Hero Squares, the last one we actually had was in Jamaica Plain. And one of the things that we've been doing is putting a biography plaque on those Hero Squares. There are close to 1,300 Hero Squares located throughout the whole city, which memorializes our United States veterans that were killed in action. But what we're trying to do is not just memorialize them, but also personalize them, because that's a person who gave the ultimate price for our freedoms that we enjoy today. So by putting a little biography thing on there, talking about them and their contributions, to service, it's a huge way. But it goes along to one of the things that was mentioned earlier. It takes a whole village to get the word out there. I think in talking with a lot of my counterparts throughout the country, I think Boston is doing a great job at that. Is there always room for improvement? I'm always going to say yes.
Yeah.
There is always room for improvement, and that also takes the assistance not just from my office, but also from your office and putting out the word. Hey, in this neighborhood, we're having a Hero Square dedication. We also in our webpage we also list all of the memorials that we have throughout the city on there as well. Not just the city's memorials, but the memorials that are either taken care of by nonprofits or the state as well. So we do everything that we possibly can to honor and recognize the sacrifice. And in partnership with the schools would be a great idea. It would be great to be able to have the face of our veterans, the face of our service members go and talk to these young adults in school to let them know, hey, I grew up in this neighborhood and I'm serving my country now. Which is why a couple of weeks ago when we had Navy Week, why those weeks are hugely important, because it personalizes our service members. Because you are correct when you say that there's a lot of people out there, when they see service to country, they know that service to country from what they see on TV, what they see in the movies, what they see in the news. So this is a way to personalize that, which is why also every year, the past so many years, we've had our own version of the Army-Navy flag football game, so we could have those Army soldiers and those Navy sailors and Marine Corps folks that are part of the Navy join us to be part of the community, to personalize their service in the community.
And is it true we're going to have an Army Week in October?
We're TBD
Working?
for now.
Yeah.
I am talking with the Army about hosting Army Week.
That'd be
There's
great.
still a lot of things that need to fall into
Yeah.
place before it happens. But I guess you got the in now because of your son.
Yeah, they mentioned it when I talked to them.
Yeah.
One last thing, and the reason why I brought up the schools is when I go to, say, like the mayor's coffee hours or other like events around the city, and community centers will show up. There was like a coffee with the cop, and like the ADSL team came over with the kids, and I often think maybe with our Hero Squares, maybe tying into a camp or a school, if it's school time, a group of kids to come and kind of be part of that festivity might be an idea going forward, to tie into the events that you already do a wonderful job. And in Boston, we set the bar high, so I know, like you said, when you talk to other cities across the country, we are doing probably more, but I know that's what we expect, and I appreciate that.
I think that's a great idea, tying in the schools to the Hero Squares program, and seeing if any local schools where we'd have our next Hero Square dedication happen. I know the GROTC, those
the high
schools,
school level, yeah.
they do a great job in coming out and doing the color guards and engaging in the community and flag planting, our veterans' graves, and also putting up the wreaths in the Hero Squares themselves. So the GROTC is one great program where we use those young adults to assist us and also to get the word out there in honoring and recognizing our veterans. But to include more young adults in the schools, I think, is something that we could definitely look into.
Thank you. Thank you, Chair.
Thank you, Council Murphy. Now I'd like to recognize Council Weber. If you'd like to give an opening statement and then go right into questions, please take a couple extra minutes as well.
Thank you, Chair. I appreciate it. I was stuck at the MBTA meeting giving some testimony. No surprise, the MBTA was running behind schedule. Okay. So thank you for recognizing me. Thank you for being here, to all the panelists. I don't have much of an opening statement. I just, I guess I had a question, and this may have been addressed before. Commissioner Santiago, I think when you were last year, we were talking, there was a veteran benefits specialist position that was vacant. Or has that been filled? I think you talked about trying to have somebody filling that kind of position.
We actually right now are down to the nuts and bolts in filling that position. I think we've pretty much identified someone, but it probably won't be for another week or two before we contact that individual.
Okay, great. And then can you just walk me through like what that position, what kinds of services they're going to provide?
Well, the veteran benefits specialist position, what they do is they are pretty much the nuts and bolts of our office. They're the ones who actually talk and investigate what the veteran needs with regards to benefits. The main mandate, of course, is going to be Chapter 115, to see if they're eligible for Chapter 115, under those provisions of the fall under the 108 CMR. But they're also there to assist the veterans to see if there's any other benefits or any other services that they may qualify for, rather if it's if they filled out the VA claim, if Mass Health is something that they need to apply for as well, if they haven't applied for it already. And then, just to get a full round picture as to what that veteran may need.
Okay, and I'm not sure if this is for you or maybe is that the Deputy Secretary online? Do we have data on how long, like on employment for people, for veterans here in the city, how long it takes veterans to find work in the city, and what kinds of issues we're facing with that?
I don't have data on that now.
Okay. I don't know. Is that Deputy Secretary?
She's
Gail
not.
Bennett?
She works at the VA.
Oh, this is the VA. Okay. Great. I mean, is that something that people come to us for services with, who are recently discharged or returning?
Well, as far as returning service members that are now transitioning into veterans, they do come to us. We do provide them with resources with regards to how long they've stayed in employment, if they've received that employment. That's data that I don't have.
Okay.
It's something that maybe I could look into, maybe keeping that line of communications open with them and seeing if we could hold on to those.
Yeah, I mean, that would be great. Did you have some comments?
Counselor, if I just add a quick comment on that. One of the biggest populations of veterans we have in the city of Boston came about as a result of the post 9/11 GI Bill. And so many of the veterans that we find coming to Boston are coming here for higher education opportunities. And you've seen an increase in both at the community college level all the way up to the Ivy League level of members of their Student Veterans Association. And one of the things we like to do is when I was working with state government is to try and support those student veterans and help them to hopefully get jobs and stay here in the Commonwealth. So there's a number of resources that are available to them, including some great resources through the U.S. Small Business Administration with Patriot Express Loans. DAV does a Patriot Boot Camp where we help young entrepreneurs. Many of the state colleges and universities, as well as private, have very robust veterans programs. Northeastern has an excellent veterans program over there right now. So I think there's a lot of outreach that can be done at that level. Many of those folks are taking advantage of GI Bill benefits, but they really, and the commissioner and I have talked about this many times in the past, problem with veterans benefits isn't that there's not enough, it's that there's a lot over a whole series of different agencies and levels of government and different requirements and things of that nature. So there's no one-door access. I mean, VA healthcare will get you good VA healthcare, but it won't get you access to a benefits representative to do a disability claim. getting your disability claim will get you a letter that says you're entitled to enroll in VA healthcare if you want, but it doesn't automatically enroll you into VA healthcare. So, and then, if we go through, if I go through the Department of Labor to use vets and to get a job through them, none of the other veterans benefits that are available to me are going to come out of that. So the problem is you're getting one benefit at a time, and then you have to find out what the next benefit is. And I can attest to this personally, because I had to become Secretary of Veteran Services for the Commonwealth in order to learn about half of the benefits that I never knew about.
You know what?
Oh, yeah.
To respond to what Brother Coleman just said, I think that we should look to the Joyner Institute at UMass Boston to try to get them to help us create a strategy to be solution-driven, because, when you want to identify veterans, a lot of veterans are in jail or been in jail, so they got that Corey thing. They got to try to fight to get the Corey cleared so they can get a job. I think that talking to Thomas Miller over at the William Joyner Institute will help us, and then he can talk with disabled veterans and to our commissioner to put together a strategy to answer your concerns and to benefit the veterans.
Yeah, thank you, Mr. Fennell. That's a great comment. I just throw out to the chair, from the chair of the Labor Committee and the chair of the Veterans Services Committee. Maybe that's something we can work on together. And I guess I just had one more question, I guess, for Mr. Nee or Mr. Fennell. I think Councilor Murphy posed the question to the commissioner about what we could be doing better. I don't know. What's something that you see that keeps coming up that we're not. You don't have enough help with.
I don't want to interrupt you, but I might not get this opportunity to talk to you again. Yeah. So I want everybody to know that there's not a strong link of information being disseminated among the different veterans groups. I, in turn, have a BNN radio and television program that focuses on veterans issues. And I'd like to invite right now these panel members to come on my show and talk about what they're doing. And that information, it goes all over. We got to work together. In order for us to work together, we got to know what each other's doing, because we're doing a lot of things. And then the ladies, the women veterans, that has just become an issue. But it's been an issue for a long time, but now it's even more prevalent. And so we need to be able to share information, care about each other, and make things better for the veterans. Remember what I said, I'm not a pest. I just want the best for our veterans.
Is it a call-in show? I mean, you could have city councilors come on and hear about.
Of course, we want the councilors to come on too.
Yep.
My show is on Wednesday, and your show is on Wednesdays, meeting the city council meeting.
The show must go on.
Yeah. I guess, Mr. Nee, did you have anything to add to that?
Yeah, just thank you, Counselor, and thank you to my good friend Haywood. One of the things Haywood taught me many years ago was, and I've really taken this lesson and we incorporated it into a lot of our programming, was that not all veterans' experience is the same, and outreach to those veterans. If I haven't had that experience of what that veteran has had, and I didn't come from the same background, or I'm not part of that same community, I might not be able to connect in a peer-to-peer way in a way that someone else could, and which is why, a lot of our women veterans will prefer to get outreach from another women veteran. And when we did jail diversion programs, all of the peers that we hired, it was the weirdest interview process in the world, because people were getting thrown out for not being as, oh, your record's too clean. They're never gonna relate to you, even though you're brilliant. I need somebody who's been in their situation, who's come out of it at the other end, to be able to give them not only a touch point where you can have discussions, but also a symbol of hope that if you can do it, I can do it. And I think, whether it's peer support to the different communities, making sure that those peers are trained and know they don't have to be clinicians, but they have to have the basic training on how to recognize such things like MST, suicidal ideations, poverty, food insecurity, things of that nature, and then have those resources through, that they could connect to, whether it's be through the city or through other agencies or nonprofits, and be a service navigator, leading them from map to map in order to get what they need to help them adjust their life, and at the same time teaching them how to do the process as well. Right. And I think that's I think peer support is one of the most important and relevant and effective methods of delivery. It's not about adding new benefits in a lot of cases. And in many cases, there's benefits that just don't get utilized because people don't know about them. It's about connecting services, people to those services, and making sure that they know how to truly access them, and then what node is that going to lead to for other benefits and services.
Okay, last question, Chair. I just, for Commissioner Santiago, I mean, we're talking about the city helping people coming from a federal institution. I mean, how can we help, you, or what issues are you dealing with in coordinating with, the federal government? Are there any issues there that we should know about, and then, we can kind of help? Because I think this is sort of a unique kind of situation where the city is sort of helping this, but obviously it's a system that's primarily federal, right?
Yeah, I think the two gentlemen to my left here pretty much put it the best way I could possibly put it, is the system is so fragmented in many different directions, and just trying to centralize all that into trying to help those, especially that are trying to integrate back into society, becomes a challenge. And just trying to be able to navigate all that is something that we continuously do, which is why the partnerships with the DAV is very important. The partnerships with the VFWs is very important. The partnerships with the VA is very important to be able to navigate that and to assist those veterans that are coming back into our community through that process, because it's a very daunting process. I don't know if you were here at the time, but when I mentioned about my experiences, serving 20 plus years in the Navy, joining directly out of high school. I didn't even go to my own high school graduation, by the way. I went directly to boot camp in Orlando, Florida, which doesn't even exist anymore. And then coming out 20 years later after serving tours in Europe and Japan and Puerto Rico, so spending most of my career overseas as opposed to being back stateside and landing here in Boston, it was very daunting, even for me, for a person who served for that long. So being able to assist those veterans, those service members that are coming back into the community. And the best way that I could think of the City Council could help out is directing them to us, directing them to our office with whatever knowledge you may have about our office as best as possible, so that we would be able to hold on to them, do that warm handoff, and then be able to assist them through the process with the other organizations that we partner with and collaborate with.
Okay, thank you to the panelists for your time, and back to you, Chair.
Thank you, Council Weber. Before I begin, I do want to give Council Fernandez-Anderson an opportunity. Did you have a question or a comment?
Thank you, Council Flynn. I'm sorry, I can wait.
Okay.
I just have a second round of questions.
Okay, sure. And I'm going to be brief on my questions. Let me just make a brief statement. This type of hearing, I purposely had my colleagues ask longer questions and the opportunity to take their time. I feel it's important that what we're doing here today is educating the public. I think we all know what the programs are, but I think the public watching on television is what we're all about, is trying to ensure that veterans and military families know about city programs, state programs, federal programs at the VA. Rob, what is the best way for someone to contact your office?
They could either email us through boston.gov/veterans, or they could give us a call. The direct number is 617-635-3030. They could call us at that number. It goes directly to our office, and then whoever answers the phone there will direct it to one of our Veterans Benefit Specialists, Community Relations team, here very soon, the Integration Transition Advocate, or anybody else in the office. They will be there to assist.
Rob, can you briefly explain for the public the Chapter 115 program?
If I could pass that over to the secretary here, I think he could be able to explain it better than I can.
Sure. Thank you, Commissioner. So Chapter 115, it's the most poorly named benefit ever. We named it after this chapter of the Mass General Law. And I think they've tried to rename it to be more descriptive. But essentially, Massachusetts is the only state in the nation that requires every city and town to have a vet service officer, either part-time or full-time, or an officer commission, depending on the population of the community. Some of the smaller communities can district and band together to save some money. But that vet service officer has the responsibility to provide services to the veterans of that community. And one of the main services they provide is financial assistance. And what, going back to the days of when public welfare was done at the city level or town level, when they took that and centralized that process, they left veterans back at the community level. And the idea was they would not call welfare to veterans, essentially. That's the real explanation of it. But right now what it is if you come in and you're a veteran, you didn't have to serve in a war, just had to have an honorable discharge and had to be statutorily a veteran, meaning a certain amount of time in service, or you're a family member of a veteran, even if that veteran is passed. So if you're a dependent of that veteran, regardless of whether you're a spouse or a dependent parent or a dependent child, you have a rights to that benefit. And that benefit is going to do a couple of things. It's going to look at your assets and your income. And it's very generous in terms of it doesn't count a personal vehicle, one personal vehicle, or your primary residence as an asset. So it really just looks at bank account money. And I think, did they just raise that, Rob?
They did. They just
so
raised
what is it now?
For a single family is $8,500.
Okay, so if you have $8,500 or less in the bank, what they're going to do is put you on benefits. And those benefits are going to be determined by how much you're getting from others. So say you get a 10% check from the VA for $750 a month for a 10% disability rating. They're going to bridge you that gap between that money, and I think for a family now it's about $3,000?
$3,000.
Yeah, about $3,000 a month. The other thing they should be doing is putting you on medical. So in terms of your benefits, any medical costs that you incur, necessary medical costs that you incur as while you're on Chapter 115, you have a right to submit those receipts or co-payments or whatever to the vet service officer, and they should be covered 100%. It brings in, there's assistance for fuel for some of our veterans that don't necessarily qualify for the financial benefit, but we can bridge them and do something with fuel assistance. And in addition, that veteran service officer should be either doing or connecting you to an organization to find to find out what your disability rating should be if you have access to one, because that will then, the higher your disability rating, that will take the liability off the community. But more importantly, it opens the door for more money and a whole network of other benefits. So any veteran can apply for that. Any spouse of a veteran can apply for that. I would just say this, based on, unless this has changed, Commissioner, you can tell me, but based on the income requirements for living in any type of public housing here in the Commonwealth, the vast majority of people that are living in public health, income-wise, are eligible. So if you have veterans in public housing, if you have spouses or dependents of veterans in public housing, there's absolutely no reason why they shouldn't be filling out a Chapter 115 application and/or then getting access to a disability rating hearing from the VA to determine if they're a federal obligation. So it's an older system. I know they're looking at reforming it. I know there's bills up there right now that are looking at making it a little more modern. Some of the language is a little old, and we've been trying to clean it up. I mean, I think can you still be denied for unwholesome habits?
You can, but that's not something that it's not something that we look at on a daily basis.
Okay, so there are like language like unwholesome habits. I mean, I don't know too many people don't have unwholesome habits. So, but it was sort of an antiquated system that needs a significant rewrite. And I believe Secretary Santiago at the state level is taking the work that we did while I was there that unfortunately just didn't get implemented in the next administration, and dusting that off and going back and looking at it. So it should be modernized. But if you're a veteran listening today and you're struggling financially, please call the Department of Veteran Services in Boston, the Office of Veteran Services, and the Commissioner's office, and ask. You cannot be denied taking an application.
That's correct.
And they have to deny you in writing if they reject your application. And you have the absolute right to appeal that to the Secretary's Office of EOVS just by writing, I want to appeal this decision, sending it in. Now, if you want some legal assistance or legal help with that, Veterans Legal Services does a great job. I know Harvard does a great job. I know the city and other folks have access to pro bono attorneys who will represent people. But people should really be taking advantage of this because it's a huge underutilized resource. And as I said, if you live at or below the poverty level, or you live in an environment where you had to prove that you are of a very limited income in order to obtain your home, this could be a resource and a benefit for you.
Thank you, Coleman.
Yeah, and to add to that, if I can, there are some limitations to Chapter 115. You have to be right now currently at 200% of the poverty level, which is an income level used for many assistance program, and Chapter 115 is one of them. So just by that alone, you may be over asset depending on how much you're earning on a yearly basis. But it's a program that's administered by the cities and towns, as like Coleman said. Each and every single town has a VSO. Some have districts, but it's approved by the state. And that's where the appeal process comes in. Once we submit an application, and again, we submit every application. We'll try to temper expectations if need be, but we always process the applications and have the state make that final determination, because that's what the program is all about. And then if they do come back saying that somebody may be over asset for whatever reason, then that's when the appeal process kicks in. But everyone isn't, every veteran, like Coleman has said, is entitled to apply for Chapter 115. But there are some qualifications that go along with that, and we could definitely, at the city level, help out with the qualification process.
Look,
Medical spending?
the other page,
Medical spend down.
the other page is a BNN Media Service Program.
Mm-hmm.
All right? We need the secretary and the commissioner to come on our program, or have someone come on our program, so that we can record this and get it out there. A sticker on the wall, we care about veterans. I don't see that anywhere. I don't see a phone number. But you know what I did yesterday on my show? I told the people, I said, listen, if you got a problem with veterans, call Secretary Robert Santiago's office, and I gave them the phone number. You should be getting some calls soon, because people are not connecting with the veteran services in the manner that they should be. Did you hear what he just said? Is what the benefits are? If people have the information, we got to get the information out there. And I'm inviting everybody in here that heard what he said to come on my show and reiterate what was said, because we don't know.
Well, yeah, thank you, Edward. If I may, Counselor, I would just say, if any of you are going to senior centers or senior housing, ask people who served in the military. You'll get a few people raise their hand. ask people who husband or wife served in the military, you'll get a lot more hands raised. All of those people are eligible to apply for Chapter 115 benefits. They don't, a lot of times they just don't know. And it's not through bad outreach efforts. The commissioner preaches this from here to the mountaintop every day. But it just, there's so much information flooding at people and so many benefits and so many scams and so many things that, you know, they, and then again, they just, you know, they just don't, or as the commissioner said, well, my husband wasn't a veteran. He didn't serve in a war. Well, he served 4 years in the Navy or the Army or the Marine Corps. Didn't matter if he didn't leave the States. He's a veteran.
He's a veteran, that's right.
And he's eligible for the benefit. So there's a lot of misinformation out there, and Haywood's absolutely right. We need to constantly be correcting the record and making sure people know about this.
We got a theater program. Triad Veterans League has a theater program. We've been performing for 28 years. They know about us. We could take some of our cast members or some of you guys and do a PSA and put it out there.
That's a good idea, Haywood. Let's see if we can do that. Maybe we'll get the City of Boston Arts and Culture and see if they'll be willing to help veterans on that PSA.
Take care of the vets, man.
And another thing also is with regards to Chapter 115 and also the VA claims, on our website, you don't have to come physically to our office to apply for Chapter 115. You could actually do it on our website, and then we will get back to you to further the process. And that's for both VA claims and for Chapter 115. And I wanted to touch on something that Coleman just mentioned about fraudulent and people out there that are going after our veterans' benefits. You know, they're affectionately called as claims sharks. A veteran who is applying for Chapter 115 or for the PACT Act, they do not, and I repeat, do not have to pay to have their VA claims processed through a lawyer. They could get it they could get that done free either through their VSO, through the VA, the Veterans Benefits side of the house, through the DAV, the VFW. There's many organizations out there that process those claims absolutely free for all of the veterans. There's no need for you to give up what you deserve, whether it's 10% or 20% of whatever entitlement that you have earned to any of these claim sharks. And again, a lot of these people that process these claims, especially through the DAV, VFW, when they process the claims, you could rest assured that 9 times out of 9, it is a veteran that is assisting you getting those claims filled out. So understand that if you are going to fill out a VA claim, you do not have to pay any money or give up any percentage of your entitlement to anyone who is requesting it. You could get it done for free of charge and get it processed just as best, if not better.
Yeah, absolutely, Commissioner. I mean, you know, please use a qualified vet service organization. We're all congressionally chartered, and we'll never charge you a dime for anything that we do. And that includes all of our services. We transport, you know, we transported over, I think, 25,000 just in the Commonwealth alone rides to free medical care, rides to medical care for veterans last year. None of that that's all cost free to the veteran. And in addition to that, yeah, veterans, I would also outreach if you're looking for areas. I can't tell you the heartbreaking calls that I would receive from people. My dad is in the hospital. They think he only has about a week to go. How do I get him his veterans benefits? And the only thing I can recommend to them at that point is his burial benefit. Because it takes longer than a week to get these things.
Right.
And the person never got them beforehand. So you know you have younger children out there, older children, but you know younger than the veteran, who know that they're going to be taking care of their medical proxy or their something along the lines. We need to reach those people to say, look, your dad won't go and get this done. You need to go get this done. And you know, and when he tells you that I don't want my benefits because I'm afraid I'm going to take away from the guys that do need it, you need to tell them that the VA bases these benefits based on utilization rate. You don't utilize them, they shrink the budget. The guys that do need them aren't getting it because you didn't take advantage of it. So you need to make sure that they know that, and that they're actively engaged in going through Rob's office to get their father's paperwork, doing this. We would have saved so many families so much heartache and thousands of dollars in care and everything else if they had just a year or two before their loved one got sick, explored the veterans benefits and were able to access it. And Rob has access to military records. He has access to St. Louis and the National Administration and Personnel Record. It's a one-stop shop over there for a lot of things. And I would really encourage you to tell younger people who look at their parents or an uncle or someone who they know that they're going to be a caretaker for. And if that person served in the military, they will save themselves a lot of headache if they start this process now.
And there's also a lot of cases, thank you, Coleman, for saying that. There's also a lot of cases where the family member would say, well, we don't have any documentation of my father's service or my mother's service. Well, give us a call. We have access, at least if they enlisted or they took the oath here in the state of Massachusetts, we have access to their DD-214, which is a discharge paperwork. Now, unfortunately, in some occasions, we may not have access because for those that are like World War II or Korean War veterans, because there was a fire in 1973 in St. Louis where they keep the records, but it doesn't mean that it ends there. There's always a way that we could figure out a service of a service member who needs that documentation.
Thank you, Coleman. Thank you, Rob. Thank you, Haywood. I do have a question for Carolyn. Carolyn, if a woman veteran is watching or listening to this program, wants to reach out to you and your team, what's the best way to contact you?
Number of different ways. So the main number for VA Boston, 1-800-865-3384, and just listening to the prompts. But I also encourage all women veterans, no matter where they are, to utilize the Women Veterans Call Center. So if they call this number, which is 1-855-VA-WOMEN, if they call that number, they can be routed to the closest Women Veterans Program Manager, Women Veterans Coordinator at the Veterans Benefits Administration, or someone from the National Cemetery Administration, depending on what their need is. So I always encourage that as well. I am, certainly available to answer anybody's questions. On our website, I have my name and my number is there as well. And the one last thing I wanted to say, just based on the previous conversation, is that if somebody has applied for VA benefits in the past and been denied, please reach out and do it again. Last night I was talking with a lovely woman who had brought her mother to an open house at one of our community-based outpatient clinics. Her father was 88 years old, had never used the VA healthcare system. We got him signed up, and then the person that signed him up never bothered to ask his daughter whether she was a veteran. And when I was talking to her, she said, I'm a veteran, but I don't qualify for services because I make too much money, and this, that, and the other thing. And we talked a little bit, and I said, wait a second, you served during this war period, you deployed to overseas, you were exposed to this, that, and the other thing. You are eligible for VA care automatically. And it was a great conversation and a great learning lesson for my whole outreach team to just remind people, if you applied in the past and were not eligible, come back, talk to us again, because the PACT Act that was passed in 2022 really changed a lot of those guidelines.
Thank you, Carolyn. That information you provided was very helpful. I just also want to add that I have 100% of my medical care is at the VA as well in Jamaica Plain, in West Roxbury, and Summit Causeway Street. And again, the care I receive is exceptional, and I just want to encourage other veterans that might not be engaged in the VA medical care to sign up for it. the VA has changed. They are more friendlier, they're more compassionate, they're more professional. What happened in the 1970s or the 1980s, it's a new VA. It's more welcoming, it's more understanding, it's more caring, compassionate, and like you said, and like my other colleagues mentioned, give the VA medical care an opportunity, because if you do enroll in it, you will find that you will receive outstanding medical care, and it's changed significantly over the years. So just wanted to highlight that maybe it helps at least one person. I'm going to stop there. I do want to go to a second round of questions, but I do want to ask if there's anyone in the audience that would like to provide any public testimony at this time. Okay. Also, no public testimony as well for anyone on Zoom. So at this time, I do want to give my colleagues a final opportunity to ask a question or a comment to anyone on the panel, and maybe take this opportunity also to give a closing statement as well, and then we'll kind of close it here. But I do want to start with Councilor Murphy, then I'll go to Councilor Fernandez-Anderson.
Thank you. I don't have any other questions. Just thank you for all that information. And as you know, our veterans come with many different needs, and there's lots of services out there. So it is important that people take advantage of all of the services that are available. And I was thinking it, but you did mention it near the end about if we don't use it, we lose it. And we do have to show that need, that we do have, veterans here who are trying to access a lot of these benefits. If it looks as though people aren't taking advantage of them, before we know it, they won't be there anymore. So I think that's important for us to get that word out there. But thank you for all you do for our veterans, and any way that I can and my office can be more of help and service to our veterans, please make sure you lean on us. But thank you for all you do. Thank you, Chair.
Thank you, Councilor Murphy, and thank you for your leadership as the prior chair of the Veterans and Military Affairs Committee, and for your important work. Let me go to Councilor Fernandez-Anderson.
Thank you, Councilor Flynn. I think, in hearing you speak about Secretary Coleman, in terms of outreach, you're saying, tell them this and tell them that, and the outreach, and you're saying, and we understand that the Commission is doing what they can right now, and I guess the conversation is really about, like, how do we look into that outreach and figure out how to develop, partnerships in a way that we can outreach more. If they're being underutilized, and we know that because we have numbers, and we know that because we have veterans, and that doesn't compare to who's applying, to the number of people applying, then obviously there's more work to be done. And so I also wanted to shout out all the military moms and dads. It's quite a thing when your son or daughter has to go away every so often for several months, come back. It's either you're healing the blisters or taking care of some sort of infection or bacteria or some sort of something, or you're stitching a uniform, or you're patching on more accolades, which is amazing. But you're up, at 3, 4 in the morning, and you're getting ready with them as well. And all of that, those emotions, and you become the counselor, you become everything else that you need to be. And I do it proudly, and I do it with so much honor to watch my son and prepare for him. And I will stitch those uniform with all my heart. And every moment for me is a proud moment as a military mom. And I still don't fully comprehend what it takes to really sacrifice yourself for our country, because I myself does not serve in that capacity. So we are indebted to our veterans, and I just wanted to say that before I get into these questions, because I do understand that you are professionals in this capacity with experience, veterans yourself, and so I know that you lead with heart. So please understand that I just want to ask questions to understand where we are and where we need to go. In terms of, the supports or networks for women, BIPOC, or LGBTQ, I guess I want to understand specifically your organizational chart and demographics of that, Commissioner. And then how many people do you need to hire, and what scope of work are you looking to fill? I've heard you mention 2 positions, but if there are any other, please fill us in.
Yeah, there are 3 positions total. One is a transition integration advocate position, which I mentioned earlier, as well as the VBS position that I also mentioned earlier. The other position that's vacant is that of the deputy commissioner, and the person who will be pretty much basically taking care of all the operations internally in the office. So those are the 3 positions that I'm looking at filling right now. And there is a light at the end of the tunnel with regards to filling the positions. And once I fill those positions, it'll definitely be able to really go out there and, like I mentioned earlier, in particular with the transition integration position, to have that person out there and taking care of those veterans and service members and their families that are coming back into to our city.
Thank you. Can you tell me the current ones that are filled?
The current ones that are filled, we have 5 veterans benefit specialists right now. We have 2 community relations specialists that is filled. We have 1 burial agent that is filled. We have a senior veterans benefit specialist that is filled. She's the one that actually works directly with our veterans that are experiencing homelessness. We have a director of outreach and policy that is filled. We have the director of finance that is filled, and then the receptionist position that is also filled, and the director of HR and operations that is filled. And of course, the commissioner position.
How many people is that total? Sorry.
So that's 5. I'm sorry. I still.
Sorry, I can do the numbers. That's okay. That's okay.
All right, thank you. I would say about 13, 14.
Okay, thank you. So you need to get to about 20 or more.
About 20.
Got it. Thank you. And in terms of your structure itself, like it sounds like it is comprehensive and holistic. You have your operationalized. You have like your policy, your finance, your HR, yourself. You need a deputy, and then in terms of service, direct service, you have. Or you will be hiring, but you do currently have the benefit specialists, 5 of them, 2 outreach, 1 burial, and the other one that you mentioned in terms of disability and benefits. And then you're going to be hiring the 3 that you mentioned. And so it does sound like it's an umbrella of services.
Yes, ma'am.
And when we're thinking about, holistic approach to not necessarily consolidating, but making this comprehensible, we need to be able to go from outreach to your workshop or education, right? To intake, to case management, to progress and follow-up, right? And then referrals, your collaterals, the person that works on that in terms of partnerships, community partnerships, and then monitoring progress means that it's a follow-up plus figuring out if we have to come in back and revisit and develop your case management plan all over again. And the reason I think about this in terms of umbrella approach is because you do need sort of that overarching person overlooking to say, where's the quality assurance or control in terms of how we're executing services for our veterans. So if I was to evaluate the department overall as a veteran myself, I would be like, oh, where's the gap, if there's one? Obviously, with building capacity, you're looking to do that, and you've already thought that through. Do you think that you have the budget, not in terms of grants or any types of contractual services, but in terms of your operating budget, do you think that you have the budget to be able to fulfill that?
For this year, yes, I do. For the future, I'm looking at, again, continue to grow the office to meet the needs of our veterans community and their families as well, as we try to fill those gaps that you had mentioned. One of the things that I will say that's been working, that's been great within the Office of Veteran Services is continuity. Every single touch that we have with a veteran is documented in what we call a case note. So if there is a veterans benefit specialist who's handling a particular veteran, that veterans benefit specialist is not available, then another veterans benefit specialist or myself or the deputy could go into the system and see what was the last touch, what was the last conversation that the veteran had with the VBS, and then we could pick up where they left off. So in continuity, when it comes to continuity in the operation of the office, that's one of the things that's been working great, where we're able to, in real time, see where the other veterans benefit specialist left off and another veterans benefit specialist can pick up. So
Great.
That's been working out great for us. It also helps me out on the field as well. If I'm talking to a constituent, talking about a particular veteran, I could go in and find out what's been going on with the particular veterans that we have in our system. As long as they are in our system. If they're not in our system, then obviously they're new to our system, and we'll put them in there. But with regards to having that continuity is something that we've been doing very well.
I appreciate that and your hands-on approach. I wanted to ask you, in terms of your partnerships with the Equity Department, if we're talking about, the disparate types of populations or populations that are more disparate than others, have you partnered with the Equity Department in terms of more outreach efforts?
We do. As a matter of fact, in my opening remarks, I did mention that partnerships with city departments is vital to the success of my office as well. We've partnered with Women's Advancement, we've partnered with LGBTQ, we've partnered with Black Male Advancement as well for all events that we do. Any type of events that are going out there in the community is something that I want to be a part of. Just last weekend, Councilor Murphy had mentioned to the flag raising for the Puerto Rican veterans, not Puerto Rican veterans, but for the Puerto Rican festivities. We were there, and it was done at the Puerto Rican
I
Veterans
really
Memorial.
appreciated that.
Yeah, and also we play a big role with the Edward O. Gordine Committee as well, and with that, so in every aspect that we possibly can, we work with the Equity Commission because we understand that the veterans population covers each and every single demographic that we have out there in our community.
Thank you. In understanding the different types of categories that need to be addressed, CORI, disability, mental health, concerns, we'll call them concerns because they're either suicidality, which is are more extreme, but sometimes it's just your regular maintenance, and sometimes it's actual disorder, right, and illness to be addressed. So I don't want to categorize it all in one box. Sexual assault, the unhoused, food insecurity, and peer support. Have you thought, in terms of these categories, have you thought about, and then you guys started talking about, prison partnerships or possibilities. Have you thought about any types of prison partnerships program where you can develop sort of like the mass peer program that actually trains and certifies prisoners to become peer support or counselors, and then transitioning, say if they're coming out home, then not only transition for themselves, but then they're already qualified to be able to go into the workforce to supporting veterans. There you have already qualified folks because they're veterans themselves and they already have a certificate.
Do you mind if I? So, Consul, great question. DEV, I think, is the only vet service organization that has an incarcerated veterans committee here in the state. I and several others from the committee have been to several facilities: Norfolk, Bridgewater, Shirley Burkowski, and I also was talking right now to the county jails, which I actually think is a better, might even be a more lucrative way to go in terms of identifying veterans and finding their benefits, because what we'll find at that level is people who would otherwise be eligible for VA benefits, but they can't because they're incarcerated. They get, I think the VA will only give them like 10%. But if they have dependents and family members, the VA will pay those dependents and family members also as well at a higher rate. So when we look at the county jail system, no one in there is going to serve more, I think, than 2 years. Well, it's going to take you about 2 years to get your VA benefits fully, especially if you have a very complex case. So identifying veterans in the county jail system, getting their interview with a VSO or someone to file a claim for them, for the VA, working that while they're incarcerated, and then having that person come out on day one and say somebody had a 0% rating, but through a combination of different factors, mental health, physical, exposure to toxic chemicals or hazardous environment, we get them rated at 100% from the VA. So now on day one, coming out of the jail, you have $45,000 in income almost. You have access to the state's annuity benefit of $2,000 at the current moment. You have priority access to vocational rehabilitation through the VA, which will pay for you to go to school or give you a tremendous amount more benefits. Your family now has benefits. Your spouse, if you're 100% rated, now goes into the CHAMP VA program, which means it's a secondary insurance card for whatever your current insurance doesn't pick up. VA picks up the balance. So, I mean, these are for necessary medical care. These are all benefits that if anyone's serving 2 years in a county facility and they're a veteran and they've never applied for veterans benefits, you've got nothing but time, and we can do and this is going to take about exactly that amount of time of your sentence probably to actually fully work this claim through the process and get it adjudicated. So I would recommend we're doing it catch as catch can. I'm not going to lie to you, it's challenging. Individual facilities are run by management staffs, and I don't necessarily think you get the same attitude at every facility. Some management facilities some management of these facilities are more open about it, and some are less. So it's really about finding the right partner. But I know that Sheriff Katusian in Middlesex County has a very active program. I'm not sure. You'd have to tell me, Commissioner, what Sheriff Tompkins has. I haven't. I know he's done some stuff.
He has done some stuff, but that's the partnership with returning citizens that we're working on.
Okay, great.
Look, let me tell you something. I remember when I was in MCI Norfolk, and I was able to establish a disabled veterans chapter at MCI Norfolk, and Ralph Cooper and them came up and established that. But like the Secretary said, it depends on the people that are in this power, quote unquote, right? Because a lot of the employees there see these benefits as a challenge to them. And it's not even their money. Why should they get this money and they're in jail? They don't need anything. That's an attitude that we got to get rid of. We must take it upon ourselves to save ourselves. Because you have these people that are in position to stop these programs that's going to help people make the transition back into the community. You're talking about re-entry. Well, if you don't help them, then the re-entry becomes a re-entry back into the prison system. And so we need to have a voice there. We need to train people. It takes a period of time to change their attitude, but we must do this because veterans and their family members, wow, did you hear what he said about the family members? I wish I'd have known about it. I would have. And then people will pick up on it and advocate more for it, to give us the strength that we need to get these policies changed.
Yeah.
And you're absolutely right, Edward. I'm sorry, Council, I didn't mean to interrupt, but just to add, in terms of recidivism, I know that in the areas where we've worked with really good veterans in prison programs, as well as good social workers, when we get people established with good veterans benefits and opportunities for jobs and income and health care, coming out of prison, when so many come out with those are the hugest barriers they're going to face. the rates of recidivism for those folks drops dramatically.
Safer communities.
Yeah.
Right, absolutely. I agree with everything you say. Of course, you're the experts, and but have looked into this issue in terms, especially with Corey. It's particularly super difficult. I would like to continue my conversation with you, Commissioner, at some point in terms of the outreach piece. Brother Haywood, I have heard, and you know that I respond to every single one of your 3:45 a.m. emails.
3:45, 3 o'clock for me.
Oh, okay. So I do appreciate, and you are and a beautiful writer. Have read part of your book, have not finished it yet, and really appreciate your advocacy, but your show, all of the events and the workshops and the education, your mental health work that you have provided for the community as well. I think that there's a conversation here that could be had. BNN needs a lot of support in terms of getting people to be more aware of what BNN is doing, and the city needs to do a better job at supporting BNN as well, with budget as well as resources to be able to thrive as a network. But I think that there's an opportunity here. You've heard him loud and clear. He is saying, look, I have this platform. I'm inviting you to this platform, and it could be used for outreach. And even at a small scale, I think there could be collaborations to support it, to build it up.
Right. And so, we don't want to forget the women in Framingham that's got records that's coming out that are veterans. They're there.
Yes, absolutely. I hope you...
we got to remember those women.
I hope you know that I of course, when I say veterans, I mean everyone. Prisons, I mean all of them.
Yeah, we got to take care of them.
Absolutely,
right.
Absolutely, and appreciate your advocacy. I will be very intentional in following up with you, Commissioner. Hopefully we get a meeting. I'm just looking to see how I can be of assistance. It's particularly, I cover Roxbury, as you know, it's in District 7. I know that some of my colleagues will also be interested in looking forward to providing ways of outreaching. There are all of these other ways that we can survey and get people to, have you served in the military, and when was that, and get that information beforehand. You have records, but if they're just beyond Boston, I want to understand where is that data. We can partner with universities. We can certainly do action research programs, or maybe some science data to be able to actually aggregate it for you, so that you're not, having to wait to hire someone.
Nice.
But there are classrooms, Spark, for example, that does great data programs at BU. I know Professor Kramer would love to look at something like this and assist. Mr. Chair, thank you so much for your grace in extending the time for me for my second round of questions. And again, thank you for your service.
Counselor, can I clear one thing up? I just want to make sure that you're aware, and while we're clearing up misconceptions, I know you had said that, you're a military mom and your child was serving and you didn't serve, but I just want you to know that in the military community, we don't consider veterans serving, families serve. When someone goes away to, particularly to a deployment, there are all sorts of things that happen to that family that they need to really go into overdrive in order to compensate. So I just, please, if you meet, I always tell military families when I meet them, they're just as much a part of the fight as anyone else. And we appreciate them and really thank you for your service as well.
Thank you.
I was just about to say that. I was just about to say the family serves alongside the veteran as well, and I just wanted to thank you for serving our community as well, and for your son's service in the military. But Coleman put it eloquently.
Hey, look.
Thank you.
I might not get a chance to get back here at one of these hearings, so I got to try to get mine off as much as I can, so you all know what's going on, right? But I don't have any problem going up to New Esther Community Garden and talking with them about housing, which I've been doing for some years now. If you could build a house like they're building houses in our community in your district, and you're not making room for veterans, and you say that veterans funding is available for housing, imagine what would happen if the council would get together and call those people up themselves and say, how you doing? How's everything going? I see you got some houses up. What do you got for veterans? Because if I call sales, just Haywood, he's just being a pest, but there I go, looking for the best,
Yep.
right? I think that the council members should take on the responsibility every now and then to check on people to see what kind of houses are being built for our veterans, because the finance is there. I was coming from the VA hospital the other day, and Heath Street is building a unit, and it was a big poster that says, supported by the AFL-CIO. So I said, oh, the AFL-CIO, you know how many veterans are in the AFL-CIO? And you mean to tell me that nobody has spoken to the AFL-CIO to help build houses for our veterans?
I have to say that both HUD and VHA has priority.
I was just trying to suggest something to you. I'm not trying to tell you
sorry,
what to do
Mr.
now.
Brother Haywood, may I? On the applications, there are questions, and they do prioritize veterans. And I have advocated with every development, with every housing development or CDCs in our district. Now, in my district. Now, in terms of the follow-through that you're talking about, in connecting and outreach with through your platforms or other, I think that's what's missing, is that folks don't know to apply. And that we have to do a better job. And I'm looking forward to supporting you and connecting, whether with the Commissioner's Office or other organizations, to be more intentional in making sure that we are doing that outreach efficiently.
Thank you.
Thank you.
Thank you. Let me ask Councilor Weber if you'd like to offer a closing statement and/or final question.
Yeah, thank you, Chair. Just a comment. I think we talked about benefits, and I totally agree that people should know that they don't need an attorney to apply for benefits. There is also, if you're denied benefits, there's an appeal process. You don't need an attorney for that. But I will say in Jamaica Plain, there's a Harvard Legal Aid Bureau has a veterans law clinic. So if people are looking for free legal advice with that, I don't think it hurts. So I'd just like to, if somebody comes and they're looking for help, they can reach out to you. They could also reach out to the Harvard Legal Aid in JP, and they can help out.
And Dan Egan and his team do great work over there.
Yeah. Okay, thank you, Chair.
Thank you, Council Weber. I would like to give Carolyn the opportunity to offer a closing comment. I want to express to Carolyn, thank you for being here. And would you also pass along to Director Ng, thank you for Director Ng for being here, for his leadership, for his testimony, but also for the work of the entire staff in Jamaica Plain, in West Roxbury, and Causeway Street as well.
I certainly will. Thank you. And I appreciate having the opportunity to be here as well. I wanted to take a moment in closing to invite anybody out there in the universe here to an open house at West Roxbury, at the West Roxbury campus of VA Boston. 1400 VFW Parkway is where we are. And on August 15th, from 11 to 1, we will have resource tables in the canteen conference room. They can listen from 11 to 12 to a teletown hall that the director will be holding with veterans from our catchment area, but also resource tables from the Veterans Benefits Administration, enrollment folks for VHA, for healthcare, and many other programs. So if you're available August 15th from 11 to 1, come on down. And we're very frequently holding these types of open houses. So just reach out and we can help you find one. And Again, our number at VA Boston is 1-800-865-3384. And on that number, you can get connected for primary care help, mental health, pharmacy, answer billing questions, have questions answered about the community care program, and of course, enroll in VA Care. So, thank you so much for having me.
Thank you.
Thank you.
Thank you, Carolyn. It's good to be with you. I want to conclude this hearing by saying thank you to the panel for being here, and more importantly, for the important work you do in the community, ensuring veterans and military families are treated with respect and dignity. We have a lot of work to do, but we have exceptional leadership with my friend Haywood, with Coleman, with Rob, with Lydia Edwards, with Erin Murphy, and Ben, and Tanya Fernandez-Anderson. I also want to acknowledge and recognize City Council Central staff that helped put this together, including Petty Officer Shane Pack.
Hey.
Yeah. Shane joined the U.S. Navy about a year ago, so we're also proud of Shane as well. So at this time, hearing that there's no final testimony from the public, this meeting is adjourned. Thank you.
All rise.